You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. We're seeing coronavirus cases explode all across the country, rising in November. Some experts expect the surge to continue while a vaccine is expected to begin distribution in December. It doesn't change the fact that there are more than 13 million positive cases in the U.S. with 274,000 fatalities. A recent poll by the David Beaumont Foundation shows that 34% of African Americans know someone who has died from coronavirus. Many are hopeful that the vaccine will prevent more COVID deaths. And David Goldberg, the U.S. CEO of DHL Global Forwarding, says his team is ready to ship vaccines worldwide.
Right now, what we're waiting for is the vaccine to be approved, the first shipments to be dispatched, and we're just standing by, ready. It's really up to the government now to give them the use authorization, and then once they're ready to go, we're standing by ready.
Joining us now, Dr. Tyson Bell. He is critical care and infectious disease specialist at the University of Virginia. Dr. Bell, glad to have you back on Roland Martin Unfiltered. Man, 1 in 3 African Americans know someone who has died from coronavirus. I mean, that shows you how devastating this is having on Black folks across this country.
Exactly. And I'm one of those who know someone who's died of COVID-19. So this has disproportionately affected our community. This has been from the beginning. It's not a new story, Roland. Many different diseases disproportionately affect our community. This is just the latest chapter in a long episode, unfortunately.
And when we talk about those who are being impacted, again, we keep urging our folks, look, to put that mask on, to practice social distancing, not go into these restaurants. Look, I mean, and we're going to show a video in a little bit about where this restaurant owner went off on these Black women who were twerking in the restaurant. It was a packed restaurant, and he himself was not sitting here wearing his mask at all times. And I just think that for so many people, they become lackadaisical and have this false sense. And we see story after story of people who blew it off. And then all of a sudden they get infected. Now they're having health issues. And some people are still having health issues 3, 6, 9 months later.
Exactly. COVID long hauling is definitely a thing. Many people can have lots of symptoms that persist even after they've gotten over the initial part of the virus. So it's not just a matter of who lives or dies, it's what kind of life you have coming out of COVID-19. And just now we're going to the winter season where we're more indoors. Viruses spread more easily in the wintertime. In-home transmission is thought to drive over half of transmission. So this is a danger period. We don't have a vaccine that's rolled out yet. So we have to be extra vigilant this time.
The thing that also I think is critical here is looking at the various decisions made by government officials. And I think people have to also stop getting frustrated and upset, because the reality is, and again, we've had enough experts on. Folks like you are still learning every day about COVID-19. And so when people say, well, y'all told us before, don't put masks on, now you're saying put masks on and do this and do that, it's because this thing continues to evolve and change.
Exactly. We learn more every single day. And sometimes that means that advice that we may have given earlier on turns out to not be the right advice to give nowadays. So this is science. A lot of science is wrong when we initially discover things. But as time goes on, we've learned what prevents the spread of COVID-19, and that's your basic public health practices: washing your hands, socially distancing, trying to avoid enclosed indoor spaces, wearing a mask. It's as simple as that, though it's hard for a lot of people to stick to, unfortunately. Some of that's messaging from the top, but a lot of it is that we have to have our due diligence, especially our community.
When we talk about, in terms of what is next, we keep hearing about the vaccine, but the reality is, are you preparing people to say, look, don't think in terms of, okay, fine, they're going to be distributing 10 million or so dosages in December, January, that really folks should be thinking that we're going to be dealing with this, and I keep saying through October at the earliest, to prepare folks mentally moving forward?
Exactly. Having the vaccine approved and even beginning to distribute is really just the first step. Once we get it to that critical mass of people, which we think is around 70 to 80% of people getting protection with the vaccine, that's when we'll start to see that benefit of herd immunity where we have more wide scale protection. But that's going to take a little bit of time in order to get that rolled out fully.
And again, so that's going to be a huge issue there. Last thing here, Scott Atlas resigned from the Trump administration. He was one of Trump's go-to people. Thank goodness. I mean, surely to me, I would think as a doctor, you're happy to see this administration go away where we can actually have real professionals speak. Atlas didn't know a damn thing about infectious diseases, and he was out here talking as if he was the most important voice when it comes to COVID-19. I'm
glad he's gone, Roland. That's it.
Simple as that. Dr. Bell, I certainly appreciate it, man. Thanks a lot.
Thank you.
All right, go back to our panel here. Candace, I'm going to start with you. I mean, look, everybody's dealing with this now. We're seeing everybody deal with this. We're seeing law schools. We're seeing elementary schools, middle schools, high schools, now businesses. So many people who are still being impacted by this. And I really think the key is to get people to say, y'all, be patient. Because a lot of the experts, again, people are learning every single day. I just think I want to be over it, but it's not going to be over. I go back to the Spanish flu. That lasted 2+ years.
That's right. And not only do you have to be patient, but you have to pay attention and watch the news and see that when we're dealing with these effects, specifically, like you said, we're not just talking about a couple of weeks. I know people who got COVID back in March, and they still don't have their taste. And we also have to share with people, not only be patient, but wear your mask, because that's just not protecting you. It's protecting me. It's like going on the road with a drunk driver. I might drive very well, but it's a drunk driver out there that I'm worried about. And then you have those I'm just gonna people. These are the people who are just gonna drop by somebody's house real quick. Oh, I'm just gonna go to church right quick. I'm gonna do the same things that I have been doing all of these years and months during COVID, and I'm not going to change my ways. So we have to get the message that not only do we have to change our ways, but when it comes to African Americans, as you said, it's affecting us in a disproportionate way.
It's all about the expertise, Kelly. And again, to me, there's nothing greater than seeing these idiots in the Trump administration leave the White House, because one of the reasons why we are in dire straits right now is because these fools were giving such bad information since January.
The fact that they're just leaving is just, it's a statement in and of itself, right? The fact that we are, 9 months in, and we're just coming around to possibly wearing masks. These people, there's a lot of people out there who still believe the propaganda, who still believe that mask wearing isn't necessary, that washing your hands vigorously at, different intervals throughout the day, whether or not you did something, isn't necessary. People believing in the hype that has been proven false time and time again, both by experts and by victims. Now, over 250,000 victims are telling you, wear a mask. And that's not going to go away anytime soon. Like you said, the Spanish flu lasted 2 years. Like Candace was saying, you have a lot of people who do the, just gonna thing. And I've been guilty of that too. And I'm changing my ways as well, because not only do I not want to get COVID, but I don't want my family to get it either. So especially during the winter months, just hunker down, do your part, wear a mask, and hopefully the vaccine will come in a time to us outside of the CDC recommendations for the priorities soon enough for more people to be safe.
It's time to be smart. When we control our institutions, we win. This is the most important news show on television of any racial background. Y'all put $2, $3, $4, $5, $10, $15, $20, $30 on this and keep this going. What you've done, Roland, since this crisis came out in full bloom. Anybody watching this, tell your friends, Go back and look at the last 2 weeks, especially of Roland Martin Unfiltered. I mean, hell, go back and look at the last 2 days. You've had sitting United States senators today, Klobuchar and Harris. Whatever you have that you can bring to Roland Martin Unfiltered to support it, please do, because this information may literally save your life.
Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.